Hello, Dr. Keith Smith with you, Surgery Center of Oklahoma. Thank you for joining us in this video blog series. We receive a lot of criticisms from the hospital apologists on social media, and two of the most common are that we are not open 24/7, and the other is that we don't have emergency room. And so we're really in no position as an outpatient surgery center to criticize hospitals that charge 10 times what we do and claim to not make a profit. I claim otherwise, and I'll tell you why. I've joked with the staff here at the surgery center that one of these days we may be open 24/7, 365 days a year if the hospitals, with their high, unreasonable gouging pricing, continue to run patients our direction. Indeed, it is patients who actually pay their bills who come to the Surgery Center of Oklahoma because they have the sticker shock. Self-funded companies as well. We are getting busier and busier, and I like to joke about that from time to time. The other criticism that we don't have an emergency room is worth commenting on. Emergency rooms ostensibly are the loss leaders in these hospitals, these so-called not-for-profit hospitals, yet there's a crane, it seems like, in front of every one that I've ever seen, always building on. I don't know a business that builds on to their loss leader. There's a hospital chain here in Oklahoma City, in Oklahoma, that's actually building freestanding emergency rooms. That certainly doesn't make sense if they're trying to not lose money in these emergency rooms that supposedly are losing them all this money. Keep in mind, too, that while there's a high capital expense to start or build a hospital, that after the emergency room is staffed, the increase in marginal cost to add an additional patient it approaches zero. It's actually equal to the cost of the supplies. So once an emergency room is open and the staff there, which is paid hourly, the additional cost of adding an additional patient, whether they pay them or not, that additional cost is very, very low once that capital expenditure is behind them. I'd like to point that out because I do not believe the emergency rooms are losing a lot of money. I think if you factor in all of the tests and x-rays and CAT scans and MRIs that in the surgeries that are done as a result of the portal of the emergency room, that these actually are vital to the success of these so-called not-for-profit hospitals. I bring this up because these emergency rooms are bankrupting us with all the uninsured. That was really one of the big pushes behind Obamacare. The hospitals are losing money in their emergency rooms, and so they have to overcharge the rest of us. We all have to have coverage. That's a big lie, and I think it's worth commenting on and pointing out. Thank you for joining us. We will see you next time.